In this video, we will go over a nursing case study. Since the new generation Nclex will implement a 6-layer clinical judgment model to prepare students for real-world medical scenarios, this case study is a great practice tool. All answers will be at the end of the video, so be sure to write them down as you go. Now let's begin. Mrs. Linda Green, a 68-year-old female, is admitted to the hospital for atrial fibrillation. She has a history of hypertension and a recent transient ischemic attack, or TIA. The healthcare provider starts her on Warfarin therapy to reduce the risk of stroke. During her hospital stay, her INR, which stands for International Normalized Ratio, is monitored closely. On day 3, her INR is 3.8, and she reports mild gum bleeding. She asks the nurse about dietary restrictions and medication safety. Here's her background information. Mrs. Linda is 68 years old. Medical history: atrial fibrillation, hypertension, recent TIA. Current medications: lisinopril 10 mg daily, warfarin 5 mg daily. Question 1. How does warfarin prevent thromboembolism? A. By inhibiting platelet aggregation. B. By promoting fibrinolysis. C. By blocking vitamin K-dependent clotting factors. Or D. By directly inhibiting thrombin. Question 2. Which factors should the nurse monitor in a patient taking warfarin? Select all that apply. A. PT INR levels. B. Platelet count. C. Signs of bleeding. D. Potassium levels. E. Hematocrit and hemoglobin. Question 3. Fill in the blank. The therapeutic INR range for a patient on warfarin for atrial fibrillation is typically blank to blank. Question 4. Mrs. Green's INR is 3.8. What is the nurse's priority action? A. Administer vitamin K immediately. B. Hold the next dose of warfarin and notify the provider. C. Encourage the patient to eat vitamin K-rich foods. Or D. Continue warfarin as prescribed. Question 5. Mrs. Green reports mild gum bleeding. What additional signs should the nurse assess for? A. Hematuria. B. Black, tarry stools. C. Petechiae or bruising. Or D. Dizziness or weakness. Question 6. True or false? Vitamin K is the antidote for warfarin overdose. Question 7. Identify the correct range on a graph for a therapeutic INR level in atrial fibrillation. Question 8. Which medication could potentiate the effect of warfarin, increasing bleeding risk? A. Acetaminophen. B. Ibuprofen. C. Calcium supplements. Or D. Multivitamins. Question 9. What should the nurse include in discharge teaching for Mrs. Green? Select all that apply. A. Avoid all green leafy vegetables. B. Schedule regular INR monitoring. C. Report signs of bleeding immediately. D. Avoid NSAIDs and aspirin. Let's see how you did. Let's now go over the answers. Question 1. The answer is C. By blocking vitamin K-dependent clotting factors, warfarin inhibits the synthesis of clotting factors 2, 7, 9, and 10, which are dependent on vitamin K. Question 2. The answer is A, C, E. PT INR levels are essential for assessing therapeutic range. Signs of bleeding and changes in hematocrit hemoglobin can indicate over-anticoagulation. Platelet count and potassium levels are not directly affected by warfarin. Question 3. The answer is 2 to 3. Maintaining INR within this range reduces the risk of thromboembolism while minimizing bleeding risk. Question 4. The answer is B. Hold the next dose of warfarin and notify the provider. An elevated INR increases the risk of bleeding. Holding the dose and consulting the provider is appropriate. Question 5. The answer is A, B, C, D. All listed symptoms are signs of bleeding, which can occur with excessive anticoagulation. Question 6. The answer is true. Vitamin K reverses the anticoagulant effects of warfarin by restoring clotting factor synthesis. Question 7. The answer is the therapeutic INR range for atrial fibrillation is 2.0 to 3.0 to ensure effective anticoagulation without excessive bleeding. Question 8. The answer is B. NSAIDs like ibuprofen increase bleeding risk when combined with warfarin due to their effect on platelet function. Question 9. The answer is B, C, D. Regular INR monitoring, recognizing signs of bleeding, and avoiding NSAIDs and/or aspirin are critical for safe warfarin therapy. Moderate intake of vitamin K-rich foods is acceptable with a consistent diet. Alright, well, that ends this video. If you found this video useful, leave a like, a comment, and subscribe so we can make more videos like this.